As we age, our eyes begin to lose the ability to focus on close objects, a condition known as presbyopia. Ophthalmologist John Hovanesian reveals an innovative procedure which gives people the vision they had when they were young.
One of the most exciting innovations in eye care for people who've lost their reading vision is implants that we put in the cornea to give them back the ability to see up close what they've lost. Corneal implants, which are also known as inlays, are placed into the layers of the cornea, which is the front window of the eye. That tissue is only a half a millimeter thick, but we create a flap in that tissue, a separation between the layers, while we're doing LASIK surgery, and that gives us a space where we can put that implant inside the layers, and then the flap goes back down, and the cornea is back just as it started. The patient feels really no discomfort and is back to seeing almost immediately. A corneal implant procedure is performed in the doctor's office. There are a couple of people who are in the room where there are lasers that help us to create the opening in the cornea. The flap that I described, which separates the layers of the cornea, is typically made with a laser. And that gives an incredible precision for the doctor to put it exactly where and what size and at what depth in the cornea we want it to be. Afterwards, there's a little bit of healing time. We usually encourage most patients to go home and take a nap for a few hours. And even after that nap, they can begin to see better. Even minutes after the surgery, they can begin to see the results, but it gets so much better the night of the surgery. Most of our patients go back to work the day after their procedure, and they find that they can already begin to see without glasses. It's really remarkable, and I hate to use words like miracle, but for most of our patients who've lost their reading vision, it's a miracle not to need their reading glasses anymore.
Dr. Hovanesian compares corneal inlays with the monovision procedure.
For years, we've had a thing called monovision, where we correct one eye for near and one eye for far. And that's still a very good solution for a lot of people. It gives us the ability to function. But monovision has its limitations. Not everybody can get used to it. There's a little bit of loss of depth perception, and you still might need glasses for things like driving after dark. So people want a better solution. Corneal inlays are a great solution for people who want to have distance vision, as well as some ability to read without a lot of compromise.
Proper screening determines the best candidates for these procedures.
The eye is an incredibly complicated organ, and there are many different diseases that can affect it. And so when we've lost our ability to read, it's not necessarily just aging changes that are happening. So we have to do a proper and a thorough eye exam to make sure there's no other disease and to make sure that someone's a good candidate for a technology like a corneal implant. This is a new treatment, and the FDA has looked at it very, very carefully to make sure that it's both safe and effective in doing what it promises to do. And of course, it's been used in other countries for a few years now. What we found is that not only does the technology help people to see better up close, but it also is extremely satisfying. Patients who are asked, would you do this again? And how satisfied are you with your results? Over 95% are extremely satisfied with their results.